Hello and welcome to Birth and Baby Talk. I'm Leanne Palmerston from Hamilton Family Doulas. And every week here on Birth and Baby Talk, we talk about stuff important to pregnant folks, birthing folks, and new parents. And this week we have a fantastic guest. Please welcome Aimee Sturley from Pure Harmony Families. And welcome, Aimee. And
thank you, Leanne.
We're going to be talking about T.E.N.S machines or T.E.N.S. So let's jump straight in. Why don't you tell me, what the heck is
it? Yeah. Well, I'll start off by showing it because a lot of people have no clue at all what it might look like. A T.E.N.S is like this. Mm-hmm. It's a little handheld unit. T.E.N.S stands for transcutaneous electronic stimulation. Electronic nervous stimulation.
That's right.
So that's a T.E.N.S. And basically, it's just these pads that you put on your back. A lot of people are familiar with it through the Dr. Ho commercials. It's a very similar kind of unit. Yep. It's different when you've got one for labor and birth because there's a special button on it. On this unit, it's right here that you press when your wave or contraction starts. So that's special for labor and birth. I have had clients who have used a regular one, but it gets really fussy because you have to go up and down every time the contraction starts or finishes. And that's a bit of a pain. So
too bad that the units aren't a little more universal in the sense that every unit would have a boost button or
I could see that being useful. The thing is they're really specialized machines, and they're specialized for all different kinds of uses. So
that's true.
I suppose that could be added to some of them. It could be a possibility. Anyhow, this is what the pads look like. So very, very typical. Now the pads are different for different kinds of units. Again, a larger pad for labor and birth is a very good thing. A lot of them you'll see are quite small. They're about half the size of this pad, which, again, I've had clients use, and it's been fine. But I think that these really provide a much better kind of sensation for people.
Sensation, yeah. Okay, yeah. So it looks like a pretty standard shape that most people probably be familiar with, at least visually, from seeing any kind of medical anything where there's transinducer pads that
exactly
information, transmitting information. So
and it's the gel sticky part that is that permits the signal to transmit. Now, a lot of people will see this and will be like, ugh. Being electrocuted in labor is the last thing that I want. Yeah. But what they need to know is that it's not like sticking your finger in a socket. It's nothing like that at all. I think a lot of people feel like, oh, it's going to be like a shock. And it's totally not. It's most often described as buzzing or tingling, or some people say it's for them like a massaging sensation, all kinds of words like that. So if you go up very high, it can get overly stimulating to the point of actually hurting. But it takes, that's why you want to go one step at a time. And once you reach a certain threshold where you feel like maybe that's a bit high for me, back it off down to the previous level, and that's going to be your best point to have it. Yeah.
It's kind of cool. So I'm going to ask you in a moment to just kind of explain how it works in terms of what it's doing.
Yeah.
But first, the first time I ever tried it, years and years and years ago with my business partner, we had invested in a couple for our business. I no longer have those ones. They're from a long, long time ago. And I think they were the precursor. Is yours an OB or an L?
Mine is an L.
I think I had an OB.
Yeah, they weren't, I don't know what your experience was like with them, but they were not that great in my experience. Yeah, I had a couple and I stopped renting them out because when I tried using them on myself and the the sensation was unreliable. So it would go up and down a little bit. It would jump, like you'd push it up one and it would go way too high. So, yeah,
That makes sense. Yeah, we were finding the connection wasn't always great between the
that
pads
too.
and the unit.
That too.
But when we did first get them, we were at a festival, like a street festival, and we had them with us because we would always bring like lots of equipment with us to show people, talk about our jobs in terms of the kind of tools we might use. And my business partner was like, said, why don't we put one on you? And I was completely freaked out. I did not want to do it. I was scared about what she put the pods just on my forearm.
Yeah. Yeah.
And she said, we'll just turn it up like to the very first one and you can see. And we ended up actually being able to turn it up quite high eventually. But I kind of loved that sensation. And I thought, you know, if I had still been having babies, I probably would absolutely love this because for me, my body interpreted it. I like the word buzzing. It's never occurred to me to use that specific word. I always call it like a stippling feeling. Like it feels like something is just doing this like, sort of intermittent kind of buzzy tapping feeling almost. Like if you took a brush and tapped with a brush.
That's a very good description.
Yeah, so it felt like that normally, and then when you hit the boost, it felt like someone would be pushing, like
it really feels like that, doesn't it?
Yeah. So I thought
it's like it goes and it grabs you. Yeah.
So I thought it was kind of brilliant, and. Like if I'm getting into grandma territory, but you know, if miracles happen and I happen to become pregnant and have a baby, I would absolutely be considering using one of these in labor because it feels pretty interesting. And you're going to tell us now about how it works, right? So
that's right.
How it works and why I might be interested in using it.
Yeah. So now I don't think there's any really solid science about why it works. We have some ideas. We know that people report that it does work for them. So there are some ideas about why that is. One of them is the widely accepted idea of the gateway theory of pain, which I'm sure you're familiar with. So the way that I like to explain gateway theory of pain is that the messages of pain and touch travel along the same route in your nervous system. And when those messages, the other part of that is that the touch messages travel faster than the pain messages, and they kind of run along ahead, block up the port, and diminish somewhat the ability of the pain message to get through to your brain. So this is one of the ways that they imagine or propose that all kinds of things help, whether it's massage or acupressure or things like that, this is a way of blocking up those ports. And this is a very lay person's way of talking about it. But
I always use an example of like your brain is like a computer and some computers don't have as much processing power as other computers. So like our brains are kind of like they have a certain amount of processing power. And if you try to open up too many, like if you're watching Netflix while trying to like download a game and you're trying to order stuff on Amazon, your computer's going to go like, wait a minute, let's just focus on the order for the Amazon because clearly that's important to you right now. And the rest of it, I can't even think about. So it's like you sort of you just throw kind of stuff up into your brain and your brain's like, whoa.
That's right.
I can't think about this other stuff. I got to focus on this.
Yeah, that's right. So that's one of them. Another one is that you're actually increasing endorphins. And this is something that they have definitely shown that it does happen. Endorphins are increased when you use any kind of touch stimulation, really. But here's a way, like you might say, oh, well, I'd rather just have massage.
Yeah.
But it can be hard to massage for 4 hours, 8 hours, 24 hours, 48 hours, right? You get tired. And you and I, as doulas, certainly know this to be true. And although we power through, it can be really good to have other supports as well, and this is a really good one. So that can help to increase your endorphin levels.
Wow.
Another thing that it's good for, just the simple fact that it's under your control.
Yeah.
I think that makes a really big difference when, especially in our culture, like there's a lot of emphasis put by a lot of prenatal educators, a lot of doulas, and rightly so, on needing to let go of control, right? In labor and birth, letting go of control is super helpful. However, I think that because of, 9 months and not even 9 months, really, because you usually don't get started really thinking about what you're going to do right
Yeah.
away, right? There's this short little window in which you have to suddenly become totally zen and let go of everything. And you can go a long way in that, and having a doula helps. And there are all kinds of things that you can do to help yourself with that. And there's all kinds of reasons to feel very positive about that. But this is another thing that you can do to help yourself that actually lets you have a little bit of that control that we love so much. Like we're trained to feel good about that control. And I kind of think that having this control can also help you to let go of control in other areas.
Hmm.
So I really see and hear very positive feedback about that part. And I mean, I'm sure you've probably had this experience too, where, you've got someone in labor and they're like, whew, and you see that maybe the cord is wrapped around their arm or something. So you go just gently to take it out of their hand and wrap the cord back around, and they're like, back off. You can't have my TENS. It's okay. I'm just going to unwrap it. You can have it right back.
I've had clients whose plan was definitely to get an epidural, or
Mhm.
who were having back labor. And they were having a discussion with themselves in their heads about, like, when am I going to get this, get an epidural? And they delayed their epidural. They delayed their original plan. I remember distinctly this one client, their original plan was to use water. They delayed getting in water. They delayed getting an epidural because they didn't want to stop using the TENS because they enjoyed the sensation so much. And of course, starting to use it early in labor, all the way up into really strong active labor, they built, they ritualized that, like,
Yes,
every single
absolutely.
contraction, they had predictable sort of, that predictable sensation happening every time that they would hit their boost button. And so they came to rely on that as the way to get through the contraction, even though, like, I know you're going to talk about this in a moment, like, there comes a point at which the signal is not a match for what's the signal that's coming up from your cervix. At a certain point, the signal that's coming from your cervix definitely kind of overpowers the signal that's coming from the TENS unit. And
That's very widely true. That's very
yeah.
widely true. There are exceptions to that. So, if you're using one and you feel like I still want to use it, well, just keep
Well,
using
of
it. That's
course.
fine. But it's very common for there to be like sometime in the midpoint of active labor somewhere.
Yeah.
You'll want to change up to something else, whatever it is. Yeah, whether it's
Or
water or
keep
whatever.
using it, but understanding that it's no longer going to be kind of like blocking or distracting
That's right.
really
Yeah.
effectively from that pain. But yeah, of course, you can still use any sensation, like, it's just for the comfort of it.
Yeah. And
And
your
not
endorphin levels will
necessarily,
be, sorry?
and I mean, I'm like, just not necessarily relying on its ability to sort of block
Yeah.
the sensation
Yeah.
or create so much
Yeah.
endorphins that the sensation feels really minimalized for you.
Mm-hmm.
When that stops happening, it can
Absolutely.
still feel comforting.
That's right. Yeah, that's
Yeah.
very true. Yeah.
Well,
And you'll have those endorphins on board. You won't be able to compare it, right? You won't know what it would have been like otherwise, but we do know that it helps to load your endorphins. And there's a little tip that I have of, if for people who want to learn more about this, I've got a
Mhm.
document that they can download if they go and sign up for my newsletter. And it's just a free document about tips and tricks, very special secret information. Actually, it is, some of it is really stuff that I haven't seen anywhere else. So people can sign up and get that for free. I'm happy to share that. And that's at my website, so pureharmony.ca. Or actually, the best way to get there is tens-rental.com.
Okay.
Or sorry, tens-rentals.com.
Okay. Excellent.
And yeah, so let's see, where were we?
So what
other ways?
Yeah, so the function of the TENS is that it sends an electrical signal into the body at a certain point on the sort of that spinal column, so that it sort of interrupts interrupts nerve stimulation that's coming up from the cervix, right, while also creating a huge load of endorphins in the system. Endorphins being pain managing hormones.
That's right.
To try and so both actions, I sort of block out and minimize the strength of the contraction as perceived by the person using the unit, right?
Exactly. Well put. Yeah. And let's take a quick look, if you are able to load that video that I sent you about how to place the pads, because at this point people are kind of probably wondering, well, this is all well and good, but what does it actually look like when it's on? Now, the picture that you're going to see in this video shows the pads, but they're not connected yet. So the connecting bits are these little lead wires. So these little guys here are what go into those white leads that you'll see in the video. So you can just take a look here and see how they're placed.
All right, let's watch.
Placement of the pads for labor really varies from person to person, but I find that this placement is a great start and tends to suit a lot of people. Basically, the top edge of the bottom two pads align roughly with the top of your intergluteal cleft, aka your butt crack. Yes, I just said butt crack. If you're wearing a top and have underwear on, it helps to have all of the leads from the pads meeting in the middle as shown here, so that they can attach to the TENS leads without making any of your clothes bunch up, which can end up being kind of a pain. As always, if you have any questions about any of this, please do get in touch with us. We're Pure Harmony Families at 778 VIP Care. That's 778-847-2273.
Excellent. And whoop. We are back.
So I hope that seems pretty clear to people. Do you think?
Yeah, I like that placement. I was watching your video earlier before we started, and what I noticed is a lot of times I see the TENS, the electrodes are placed, or the pads
super high.
Very high, yeah, just under the bra line and just above the underwear line. But it looks like you take a pretty typical, say, pair of bikini underwear, the elastic for the underwear. The pads look like they're just above and just below that.
Exactly that. Yeah, precisely. And you can also use your dimples, your little dimples of Venus, as they're called, as the kind of mirror point for those. What's the other thing I was going to say about it? One thing that I think about that has occurred to me about that high placement is I wonder if that's responsible for a lot of the feedback that people often give, that the pads or that the TENS unit doesn't work past very early labor. Because just think about how that sensation moves down in your system, right?
Yeah, and I think maybe it comes from a misunderstanding of where the majority of the sensation of each wave or contraction comes from, which is not from the action of the uterus. The uterus, as we know, when women have pregnant people have Braxton Hicks contractions, right? And the uterus tightens up and there's almost no sensation for most people, or a weird tight muscle sensation.
Yeah.
It feels strange, but not necessarily pain. It's that stretching open cervix that causes so much pain
and also anal pain, actually. That comes along for so many people. Yeah.
So shifting those electrodes down, like when I saw that, I was like, God,
bingo.
That makes so much sense, because now we're really focusing on trying to not let those signals from the cervix get very high in the spinal column where all the nerves are moving.
Yeah, I experienced really very trying endometriosis for most of my life.
Okay.
I am, thank God, menopausal now.
Right.
But yeah, it was tough, and I really found that wearing T.E.N.S helped, and that's how I, for myself, figured out that it should be lower. It made a big difference for me. So.
Yeah. All right, awesome. I'm going to put that in my back pocket.
Yes. I hope that
knowledge.
I hope to spread that word, because it is a little different. When I lived in Vancouver, I shared that with the doulas that I knew there, and a lot of them adopted it. So yeah.
Excellent. And so, what like, is there a particular person who might benefit from this the most? Like, who is this for? Every single laboring person?
Well, I mean, obviously, you have to judge for yourself. I think it would be easier for me to talk about who it's not for. If you have a pacemaker, it's not for you.
Okay.
If you have any kind of skin trouble where, your skin might have lesions on it for any reason, it's not going to be for you. If those lesions are going to be where the pads should be placed, obviously.
Yeah.
You should always talk to your caregiver, your healthcare provider, before you go ahead and rent or buy. And obviously use. But also, I guess, if you had some sort of phobia about electronics, it wouldn't be for you. But I think it's really good for anyone who wants to delay an epidural, if they're thinking of having that or other pain medications. It's good for home use, because, where you can't get anything else, you can get that. It's great for hospital use, as long as your hospital knows about it. Like, I'm sure that there are some hospitals out there where they might be not quite well versed with it and might kind of shy away from it. So it's good to check that out before.
And with regards to hospital use, now I know in Hamilton, our hospitals have their own units. They're notoriously broken. I hear all the time nurses say, I'm sorry, but it's not working, but I'll check.
Right. Yeah.
So we're pretty lucky in that my local area is quite aware of what they are. But would you recommend potentially someone bringing some information with them to?
It's not a bad idea. Yeah. Like I share an FAQ about T.E.N.S units, how they work, how they're used. You could just include that. You could bring it to one of your prenatal sessions, right? And just have that included in your chart and put it in your birth bag. And then it's, in case it gets lost somewhere along the way, which happens sometimes, you have an extra copy to give out. Because that can certainly help, especially because you don't want to be, either you or whoever you have as a birth partner, you may not be wanting to explain things at that point, right? So being able to hand a sheet is a good idea. Yeah, I hadn't thought of that, so that's a really good idea. But as far as who can use it, it's just such a versatile little machine. And one of the great things about it is that you've got so much freedom to move around, right? Which is one of the important things in labor. If you're feeling up to it, moving around is really, really good for the placement of the baby and all that kind of stuff. So you can take it outside, you can walk around inside. You can't take it in the shower or in the bath, of course. But hopefully, I always recommend that people get as close as they can to being in the bath, and then take the pads off, and
that's true.
Minimize the gap.
It strikes me that this might actually be a really great time in history for using T.E.N.S, for opting to explore it as a labor coping technique, since so many people will not be able to ongoing from what the last year has been. They won't be able to have additional labor support help. So if if when you imagined what your birth would be like 5 years ago or something, and you thought, I'm definitely going to get a doula to help me get through labor, and then you can't have one at your local hospital, having something like this can be the sort of the next best thing.
Exactly. Yeah. I mean, I would never recommend do this instead of getting a doula.
But if you can't have one with you,
yeah.
Or you can only have one like if you opt to have a virtual doula, I think this would be the perfect companion tool for that.
Precisely. Yeah. Yeah, absolutely. It definitely has been one of the things that people who are renting now are talking about when they get in touch with me. They're like, oh my God, I really wanted a doula, but I couldn't have one. So yeah. And I just recently had this little thank you here from one of my clients.
Aww.
It was so nice to get. Little smiley face. Thank you. The T.E.N.S machine helped hugely. I had an extremely positive birth experience. So
oh, that's really wonderful.
I keep it up here because it feels good.
Now, what should people be aware of? What could be some drawbacks or problems that people want to be mindful of?
Well, I mean, definitely be aware of if the sensation is not feeling good to you for whatever reason. You can go through a few checks of things like, are the batteries, try changing the batteries, seeing if that helps, because if the batteries are low, it'll give a strange pattern. The sensation can be pinchy or start to be erratic. So definitely check the batteries. Even if they're still working, if they're getting on the low side, it can be a problem. I do include extra batteries, of course, so that's always there. Things to watch out for. Just the one thing is just keeping the cords untangled. It can be a little bit of a little bit bothersome sometimes. Just having someone to keep their eye on it and manage it for you. Because when you're in labor, untangling them is like, you cannot think about that. Like, undoing a knot. It's like, no. So that can certainly be something. Let's see.
And
I can't
not getting anything wet. So like they're
not getting them wet. Obviously, you can't go in the shower. If you got some moisture on your back, of course, it's not going to be the end of the world. You want to not get the unit itself wet for sure.
Okay.
That could be a problem. And you can take them. Oh, allergies. So if you have allergies to, you have allergies to adhesives of one kind or another, I don't know how that translates exactly to the pads. What kind of adhesive it is. You'd have to maybe look into that, or you could give me a call, and I'd certainly be able to help you figure that out if at all possible. That can sometimes be a problem. It can cause a reaction. Another thing, the pads can become worn. Like if you're sweating a lot, it can end up getting into the sticky stuff in the pads and making it not function anymore. So one nice thing is that being sweaty keeps you conductive, but the problem is you have to keep it on your back. So you can just use tape, and if you're at the hospital, of course, you can always just borrow the nurse's tape. Just ask them if you can use that, and you can keep them on that way, and that helps. But make sure that the whole thing is touching completely as much as possible.
Yeah, because I've seen them when they get sweaty, they can sometimes sort of
they do. Yeah. Now it's not the end of the world, but just keep it as in full contact as you possibly can. So more tape is better. Yeah.
Okay. Good.
You can take them on and off, so you can replace them. Just make sure you put them on the on their backing.
Little glossy pad or paper.
Yeah, these ones are on plastic, and
Okay.
then put them back in the envelope and seal the envelope up. So
Okay.
another thing you can do is just put a little bit of gel on the back, and
A little
that can,
the transducer gel.
yeah,
Yeah.
that can help
Okay.
too. Yeah.
Excellent. Those are really, really good points. Now, are there any other uses? We've talked very specifically about use for labor itself. Is there any other way we can use it?
Absolutely. Absolutely.
Tell
If you
me.
get the A-OK from your care provider before labor, you can certainly use it from week 37 on.
Okay.
Again, you can put it on your lower back, you can put it on your hips. A lot of people will avoid putting it on their shoulders because that's an induction point for acupressure. So in pregnancy, a lot of people will avoid that.
Okay.
Um, but yeah, look, hip pain, lower back pain, it can definitely be very good for that.
Prodromal pain.
And prodromal labor, absolutely. If you're having this long practice labor before things really get picking up and progressing in terms of cervical change, then it's a really good time for it. It really helps. Yeah.
Yeah, that is good.
Hmm.
That just occurred to me right now.
Hmm. Yeah, very much so.
It
Yeah.
just breaks my heart every time a client, lets me know, like, oh, I've been having pains off and on, like, for days, and they get so
Hmm.
worn out. So it's nice
Hmm.
if we can give them some tools to
Yeah,
manage that, and not just manage that pain, but also create comfort, because
that's
it's
right.
like it's sort of double-sided. Like, it feels good. It feels like an interesting, good, helpful feeling, while also sort of functioning physiologically to do stuff. So,
That's right. Yeah. Now, you and I are both infant sleep educators. And so I also like to think of it in these terms because you're heading towards your labor. You want to be in the best shape that you can be to meet the demands of early parenthood. So you want to get as much sleep as you can beforehand as well. You want to be in as good shape as you can. And I find that using the T.E.N.S, if you're having this prodromal labor, it can help you to get that extra sleep that you need, both to meet
yeah.
the demands of labor and to meet demands of early parenthood, for sure. And then again afterward, so postpartum, then certainly you can use it on your shoulders. If you're doing this all day, right? Whether you're breast or chest feeding or you're feeding by bottle, you know, you're doing a lot of carrying, a lot of looking down. And I would also add that it's really good every once in a while to just lift your head, just do that and let your chest open up and your shoulders fall back. And if you can get your partner or somebody who's with you on a regular basis, or at least who's on the phone with you on a regular basis, to remind you to do that, that can be a big help too. Yeah. So postpartum, yeah, again, you can use it on your low back, on your shoulders, on your upper back, anywhere that you're feeling those pains from all the work that you did. Mhm.
Excellent. Yeah. And I'm thinking too, like, if you're expecting like your second or third or fourth or more baby, which
Mhm.
are the after pains that we get in those first week or two of nursing a baby while our uteruses are shrinking back down,
Yeah,
those pains can be really
it's
debilitating
really
when you've
helpful.
already had at least one child. So this
Yeah.
could be a great non-medicinal way of managing those sensations.
That's absolutely right. Yeah. Yeah, it's very
Oh,
helpful for that. Mhm.
wonderful. Well, I think
Yeah.
you've given us so much great information, and I'm really excited.
It's
I think
it's
I
so much more than people think, right? Like,
Yeah,
yeah.
it
Yeah.
is.
A
And
lot of
I'm
people, I
really
think,
Oh, I was just gonna say, like, I'm really jazzed about the idea of trying it out with a client and placing those pads a little lower and seeing
mhm.
how much more effective it can be for them.
Yeah. Yeah. Well, I look forward if you have time, let me know how it goes because I'd really love to hear back about that. Yeah.
Oh, I would love to.
Oh, and I want to let you know, and anyone who's watching, that I have a discount code for anyone who's listening in here.
Fabulous.
So the discount code is BBT25, and that's for 25% off any one thing that you can get on my website. Now, of course, if you're not in my area, it has to be something that you can do online, or T.E.N.S rental, obviously, that can be sent to you. So,
And your T.E.N.S rentals are Canada-wide or
yes,
Ontario-wide?
Canada-wide. Canada-wide.
Okay.
That's right. Yeah.
Awesome.
So, yeah.
All right.
And it
So,
includes everything you need, and it's the longest rental. I mean, obviously, I haven't looked at every single one, but I've looked at a lot of them, and I haven't seen any that are longer than mine. So I really wanted people to have full use of it and really not have to worry. Like, worry is the last thing you need. So I
yeah,
include 3 free sets of pads, which most people don't do. You can call me anytime. I love talking to people about using them. So, yeah.
wonderful. So BBT25 is the discount code. If
Yes.
you want to go to TENS-rentals.com.
Yeah, that's right.
Awesome.
Yeah.
Then you can take advantage of that and rent or purchase one of Aimee's fantastic products. And we will have that code in our newsletter as well for folks who follow along. So if you are not signed up to our newsletter, please sign up to our newsletter. And also go to Aimee's website to make sure you sign up for her newsletter so that you can grab that fantastic resource about tips for using your T.E.N.S machine.
And I made a mistake. It's not T.E.N.S rentals, plural. It's singular.
Okay. So
Sorry.
T.E.N.S rental or TENS-rental.com.
Yes, you got it.
We'll have that information in our newsletter.
Thanks, Leanne.
So no problem. So no one will miss the opportunity to rent a T.E.N.S or to check out the other stuff on the website.
Yeah.
Thank you so very much, Aimee.
Thank you. It was really fun. You're such a good interviewer.
Oh, stop it.
Ow.
And we can share that next week I'm going to be on your show. So tell us all
That's
about
right.
that.
Well, you're going to be coming onto my show, which is I've framed it as a live drop, and it's fairly new. It's quite a bit newer than your show, so I'm still finding my legs, but it's lots of fun. We've talked in the past about talking about racism with your kids as a white family. We've talked about swimming with your baby, having a slow postpartum with a slow postpartum expert, all kinds of things. So we're having lots of fun with that. And next week we'll be talking with you about sleep products, the good, the bad, and the illegal.
Yes. I'm looking forward to it. I'm spending this week putting together my final list. And I'm looking forward to working or talking about that. Because goodness knows, like in the course of my work as a doula, as a postpartum doula, as an infant feeding specialist, as an infant sleep educator and consultant, like I see a lot of stuff that some folks, well, there's a lot of things that folks don't know, and there's a lot of products that are sold to folks that just make me go,
Yeah.
So we'll cover those.
Yeah, and we'll chat about that. And we'll chat about why it's a problem or why it could be a problem, so people can make up their own minds about what they want to do. Yeah,
absolutely. So that's awesome. So folks, if you're not signed up to our newsletter, get signed up. There is a link in the comments. Actually, there is now a link in the comments. You can get signed up, and we'll have all the links to all of this. And come back next Wednesday at noon for another live show where we're going to be talking about preeclampsia, why you really need to understand what's going on, and because it's kind of serious. So we'll be talking about that. I'm hoping we are going to have our wonderful friend, Dr. Brian, joining us to talk about that from a provider's perspective. So join us every Wednesday at noon on Facebook, or pick up our shows afterwards on YouTube. And just want to thank you all for being here and hanging out with us. Thank you, Aimee. I very much appreciate your being here with us too.
Thanks for having me.
Until next week, folks. See you later.